Hi, good evening, everybody. Welcome so much. And I thank you for joining me tonight on YouTube Live. I'm Dr. Howard Elkin, the medical advocate. And tonight we're going to talk about how to ease into 2022, the year of the medical advocate. Now, we've really been consumed the last 2.5 years with COVID-19. Everything dealing with, started off being a respiratory illness, then it became a cardiac or heart problem, then it became a hematologic illness with blood clotting, then it became a neurologic problem, then it became a renal problem, kidney. It ended up being a multi-system disease, and we've been consumed with it. And we've really altered our lifestyles accordingly to promote social distance, and wearing masks all the time and not going out. And it really hasn't been a good time. But, if you look at the United States alone, we've had over 60 million cases and over 836,000 deaths. That's a lot. And new cases, get this, with the new variant, like 446,240. The last 7-day average as of January 8th, when I did my little research, get this, 7-day average, 714,000 new cases. Okay, it's remarkable. Now, since mid-March of 2020, I've been promoting lifestyle, and I haven't stopped. Even though the government hasn't preached this, even though most of the people in the medical profession, from Dr. Fauci all the way down to Gupta, no one's talked about it. Everyone talks about vaccines, and I'm not saying that's that important, but lifestyle is really crucial. I came up with my own little supplement, Immunowise, which has all the vital important vitamins you need to help maintain a strong immune system. So really, you need to have a strong immune system and a powerful, and you need to be metabolically healthy, which we'll talk about in a minute. So that was in the past. Now we're going to move forward to 2022. And again, I say this is the year of medical advocate. I'll tell you why. First of all, I'm coming out with my book. My book will come out in a few weeks. It's called From Both Sides of the Table, When Doctor Becomes Patient, Becoming Your Own Medical Advocate. Yeah, I became my own medical advocate by being hospitalized twice in a 17-month period. But most of the book is really for all of you. It's how you can become your own medical advocate. It's work. There's no free lunch here, but it can be done. It should be done. And this is the year, by George, that we're going to do it. So I'm going to start off this year with some easy health tips that I think most of us can follow. And first of all, I don't like this word resolutions, New Year's resolutions. First of all, did you know that a study out of 2016 said, get this, of the 41,000, of the 41% of patients, Americans, that make resolutions, the end in 9 months is like 9%. They're going from 40% to 9%, which is just dismal. Get this. Okay, so 1 week after making resolutions, 75% are still successful. 2 weeks, the number drops to 71%. After 1 month, the number drops to 64%. After 6 months, 46%. It just keeps dropping. And what are the 3 most common resolutions? Let's see, quit smoking, start exercising, and lose weight. Okay, but that's just it. That's just like a resolution, but it's not a plan. So what medical advocates do, we actually make goals as opposed to resolutions. And besides making the goal, we have to do a action plan to fulfill that goal. And with an action plan, you have a timeline. I'm going to do this by this month, and it's carefully planned out. And tonight we're going to focus on some easy tips that I have developed for myself and for my patients. And you may have your own. This is not an exhaustive list by any stretch of the imagination. You may have your own, and it may not be for everyone. Okay, so, and the most important thing is that you always want to get this stuff checked out with your medical provider, because I'm just talking in general terms. Okay, so I like to start number one, I like to start my day with a glass of lemon water. I take juice from a freshly squeezed lemon, organic lemon, of course, and I drink the entire glass. That's really one of the first things I do. And why? Because it's hydrating, for number one. If you've been sleeping all night, guess what? You're pretty much dehydrated. How do we know that? When you get your blood drawn, the phlebotomist puts the needle in the arm and like no blood comes out, right? Or it stops flowing because you're dehydrated. And one of the blood tests that we commonly use called a BUN, it's part of the kidney function, that's often slightly elevated because you're dehydrated. So the first thing you need to do is to have a glass of water with freshly squeezed lemon. It also has vitamin C. We all know vitamin C is very important antioxidant. It does enhance immunity. and also has some antibacterial and antiviral effects. And it also enhances digestion. And guess what? It also helps to refresh your breath. So there's even some talk that it may have some cancer prevention. There is no downside to starting your day with a glass of water with freshly squeezed lemon juice. Number two, this is my list. Eat the majority of foods at home. And I think a lot of us had this opportunity. We really got this opportunity with COVID. One of the good things is to eat at home. So why is eating at home better than eating in restaurants? First of all, you know what you're eating, right? You know what's in your food. You can control what you're eating. You can generally avoid overeating. I mean, I don't know why people walk out of restaurants with doggy bags. I mean, seriously, it's the portions are the portions that huge? Yeah. And also you get quality food. Okay. So if you are like me and you want to go organic or cage free or wild fish versus farm raised or non-GMO, you can do it when you cook and make your meals at home. Because I can guarantee you at most restaurants, you aren't going to get that kind of food. And also a lot of restaurant food is pretty high in sugar, gluten, and also salt. So you can bet your bottom dollar that you're going to have healthier food if you make it yourself and eat at home. The next one, number three, I like having a meal curfew. Ever hear that? A meal curfew means you stop eating at a certain time every day. So I'm working on that now. I used to, just until recently, I was like staying in my office after hours, doing my charting, coming home eating at like at 9 o'clock at night, and then going to bed within a couple of hours. That's like really bad. And I stopped doing that. Now I try to get home early. Well, not tonight, but I try to get home earlier. I'll bring my work with me. I'll have dinner at a much earlier. Then I'll do my charting. I have the same electronic medical record systems at home, so I can do that. The important thing is to try to eat early and nothing after that. So I'll have my dinner. I'll have fruit for dessert, and that's it. Nothing after that. That's a meal curfew. So why is that so important? It helps with digestion. Okay, it's easier on your gut, and most important, it enhances sleep. You're going to get much better sleep if you aren't on a full stomach. Okay, 5, stop the snacking. Okay, grazing is out, guys. It's just out. It adds unwanted calories. And I know a few years ago the talk was, okay, we got to eat small, frequent food, right? Frequent meals. And in bodybuilding, when I was competing, that was like the sine qua non. That was like what you have to do. And I did it, right? And when I was getting close to competition, I was eating like every 3 hours. Okay. My moods were horrible. I was going up and down, up and down, up and down. And then if I just say I missed a meal, let's say I went 3-4 hours without eating, I would become extremely hypoglycemic. I mean, I'd be seeing a patient. I'd start off sweating. My heart rate would be racing. It's not a comfortable place to be, and it's not healthy. So, historically, 3 meals a day is actually relatively new in the Industrial Revolution. The Romans didn't eat breakfast, and it was frowned upon actually by them. But when the Industrial Revolution, when we had more laborers working, people in the workforce, 3 meals a day became common. But all this snacking is really taken place in the 20th century, the later part of the 20th century. And now people are eating 16 hours out of 24. That's just ridiculous. 16 hours out of 24. That is the average. And your immune system is also affected. Now, eating is important. Eating does enhance, it triggers your immune system, as does exercise, right? These are good triggers. However, eating like constantly, every time you eat, you're going to trigger your immune system. So actually, and they've actually have done tests on this, that some of the inflammatory markers have been increased in people that eat frequently. So it's not a good idea. And basically, what are the snack foods? Chips, dips, highly processed foods. I mean, yeah, people like carrot strips and celery strips, but I'll tell you, that's not the majority of people who snack. So snacking's out. Now, intermittent fasting, I've talked about before. This is number 5. Now, I don't think fasting's for everyone. I do it. I do intermittent fasting. It's been great for me. What it can do is to improve your metabolic health. And it's really important because if you remember from any of my previous YouTubes, only 12% of us are metabolically healthy. That means 88% of the adult American population is metabolically unhealthy. What does that mean? Well, first of all, don't take my word for it. Look outside. Overweight, big waist to hip ratio, high triglycerides, high blood sugar, fasting blood pressure is elevated, low HDL or the healthy cholesterol. That's the bulk of the people you see. they're just not healthy. And these people do very poorly with COVID. So, and I tried to warn people at the beginning of this pandemic about it, but as you can see, it didn't really help because 62% of Americans gained weight during COVID. And the average weight gain for those people was like 25 plus pounds. And the most depressing news of all is that children, ages 6 to 11, doubled their rate of obesity. These poor kids don't have a chance. If you develop that many fat cells at such a young age, it's just plain sad. So, intermittent fasting can help keep you on track and make you more metabolically healthy. I'm glad I do that now. But the easy way to do it is just go 12-12. Go 12-hour window of eating and 12 hours of fasting, and or have your 3 meals a day, and don't snack. Okay, that's easy to do. Now, I'm more advanced at it, and I've been doing it for a while, so I'll do at least 14 hours, and on weekends I can easily go to 16 hours or so while fasting. I don't do prolonged fasting myself because I don't want to become catabolic and lose muscle mass, but intermittent fasting can be very useful. My moods are more stable. I'm nicer um, because I don't have these ups and downs that I would get when I would be eating more frequently. So intermittent fasting works for me, but it's not for everybody. Exercise. Okay, exercise is number 6 on my list. Okay, but there's too much to talk about. We're going to just focus on resistance training because that's big in my heart. And if you aren't doing any kind of weight training, you really need to do it. And that's just the year of the medical advocate. We're going to start doing that. I suggest starting off 20 minutes twice a week. Most of us can do that. 20 minutes twice a week. Get yourself some low weight dumbbells. Get some resistance bands. You can join a gym. Gyms are open now. You can wear your mask. And you can also seek the help of a trainer because you want to learn the proper way. You don't want to get injured. But resistance training or weight training or bodybuilding is the only real fountain of youth we have. It really is, because if you don't have strength, you're not going to be able to open a jar or shut a window or hang a picture frame. It's so important. That's why people end up in nursing homes, because they have lost the ability to do things for themselves. We call them activities of daily living. So it's so important. I can't emphasize it more. It's a must on my list. It should be a must on your list. 20 minutes twice a week. And you'll probably end up liking it. Most people that work with weights end up really liking it. So, but it's so important. Okay, another thing. I like a post-meal walk, okay? That's number 7. That's a new goal of mine, but the studies have shown, I did some research on that if you walk after you eat versus before you eat, let's say after your dinner meal, and we're talking like a leisurely 15, 20-minute walk. We're not even talking about exercise intensity here. That actually can decrease your blood sugar, improve your insulin sensitivity. And they've done studies that shows that it's more effective to walk after than before. Some of us do that intrinsic, from before, but there's research behind it. So a very short, leisurely post dinner or post meal walk is helpful. Okay, supplements, number 8. I'm going to have a whole session on supplements, but I'm going to talk about one that's vital that everyone should be on, and that's vitamin D or vitamin D3. We know that people that do poorly on COVID have low levels of vitamin D. And it's especially important in people of color and African Americans. I had an African American patient, and I saw him back in August, and I said, I think his level was like 16. I said, you need to take vitamin D to protect us against COVID. Well, to make a long story short, he ended up getting COVID like about 6 weeks later. So I saw him recently. He was in the hospital for 3 weeks. He had respiratory failure. He was this close to being intubated. And he's having problems. I think he's going to be a long hauler. I check his vitamin D level. It's 16. I said, dude, we talked about this months ago. It's so important. Now, I don't believe in just taking it blindly. You should get your vitamin D level checked. And if your doctor says it's not covered by Medicare, that's bull. Okay, I'm going to tell you the ICD-10 code. Write this down, guys. E55.9. Again, E55.9. That is an ICD code that Medicare will cover and PPO insurances will cover. And it means vitamin D deficiency. And guess what? Almost everyone I see has vitamin D deficient. So it is covered. And you want a level somewhere, like the level of the scale is 30 to 100. Well, why do you want to be 30 if you can be 100? So I like it to be around. Most studies have shown that really good results with levels like, let's say, more like 60 to 80. Okay, that's what I usually shoot for. And it's really more than just a vitamin. It's got anti-inflammatory properties. It's so important, and it's definitely part of my product here. Okay, there's one other. I wasn't going to do this, but there's one other little something I really like. It's called glutathione. Why? Because we have seen recently that they've done on patients that are hospitalized with COVID, they have very low levels of glutathione and they have high markers of oxidative stress. Duh. I mean, that makes sense, right? So, but glutathione can be expensive. I'm fortunate that I have an IV nurse, an RN that she comes in every week, and I try to get an infusion of Myers cocktail and glutathione, IV push, every 2-3 weeks, just as a prophylactic. But you can do it orally. They do have certain forms of of glutathione that you can take orally, but a cheap way of doing it is NAC, N-acetylcysteine, which is a precursor to glutathione. And I take 600 milligrams twice a day. It's also in my product. And almost everybody will be able to convert NAC to glutathione unless you are really protein deficient and you have a glycine deficiency. We're not going to go there, but those are really pretty sick patients. So most people can do that conversion. Okay, 2 more. Number 9, meditation practice. It's a must. I'm an adrenaline junkie. Okay. I mean, when I have to go in the middle of the night and open someone's artery, I'm like buzzed. I'm buzzed and I can't get back to sleep. And it's a kind of good buzz, but it's not really healthy. I meditate. I try to do it every single morning. And we'll talk about that in another session. I'll give you my techniques, but it's very important. Another thing you need to know about this thing called the vagus nerve. So the vagus nerve is number 10 of the 12 cranial nerves. And it basically governs the parasympathetic nervous system. So if you look at the autonomic nervous system, there's 2 components. Number 1, the sympathetic nervous system, which is fight or flight. We all got plenty of that. And number 2 is parasympathetic, which is like your Zen-like part, the Zen-like nervous system. So that eases digestion. It slows your heart rate down, slows your respiratory rate down. You need the balance. I mean, if you're being chased by a saber-toothed tiger, you better have fight or flight. But to be able to sleep at night, you need a parasympathetic system. So I recommend activities that can work on your vagus nerve and parasympathetic nervous system. So, and I do a lot of these, as some of you may know: cold exposure, exercise, omega-3 fatty acids, massage, meditation, probiotics, singing. Like when I have a singing lesson, I'm on like a high for at least 3 hours. And I noticed it when I brought my youngest daughter was a child. She had a very good voice. I brought her every week for a singing lesson, and it just changed who she was. It was so good. And also slow, deep breathing. Now I'm going to show you one little technique, because I know we're getting short in time here. I'm doing more talking than usual. How you can reset your vagus nerve. So if I say you've had a very tough day, and you key it up. Okay, so this is a great way of doing it. You take your fingers, your hands, and you intertwine them like this, and you put them behind your head like this. And it's best to do this lying on the floor, okay, versus sitting up like here. And what you do, you look straight. You do not move your head. You move your eyes to the right, and you keep them in that position for 30 seconds. Then you go back neutral, and you go to the left. So you're doing 30 seconds on each side. You can do more than 30 seconds. Hopefully you'll yarn, you'll sigh, and that helps you reset your vagus tone so that you can easily go into your meditation. So it's called resetting your vagus nerve. And the last thing is sleep. Sleep is so important. It improves your memory. It can lower your blood pressure. It helps you fight disease. It helps you control diabetes. It fights inflammation. It's so important. And I'm working on that now myself. And so there's 2 types of sleep you got to know about. REM, which is rapid eye movement, which is important for creativity, memory consolidation, dreaming. Okay, that should be about an hour and a half of your sleep per night. And then probably the most important is your deep wave sleep, which is basically restorative and restoration. Now, how do I know all this stuff? Well, I got this thing called an Oura Ring, OURA. It's phenomenal. And this is what I've done. Number 1, I'm eating earlier than I used to, so I don't so that aids with my sleep. Then I have these blue block glasses. You can get them at various locations on with Amazon or on the internet. But They block out blue light, which is really important because it's the blue light that really interferes with our sleep. And we should minimize our screen time. Ideally, this is hard for us to do. We should stop looking at the screen for an hour or so before we go to bed. Remember when we used to read books? Well, maybe we should be doing that again. Sleep is very important. Another way you can help with your sleep hygiene is, again, retire and awake in the same time, hot bath or shower. And I'm a cold person, a cold water person. I do my showers in the morning, but hot showers can be useful. Exercise early in the day. I don't really know, matter what time you exercise, but if you may want to exercise earlier than not if you have a sleep issue. Herbal tea and avoiding caffeine. So those are 10 of my own tips, all of which I'm using. And I would like you to embrace some of them. But now in the few minutes we have left, I would love to hear from you. So any questions or what you personally like to do as kick off this year. So please. Okay, let me see. What do you think of chlorine dioxide as a COVID treatment? I don't know. I really don't know anything about it. I'm going to be perfectly frank with you. Um, I really don't. Most of what I treat are COVID complications, especially if they deal with the heart, cardiovascular system. So I'm not the first. I'm not the first. I'm not first line. In my hospital, if you get admitted with COVID, you see it by intensivists. But now with the new variant, the Omicron variant, people aren't getting as ill if they've been vaccinated and boosted. But as far as primary treatment, I really don't know. Sorry about that. Okay, is your lab test for glutathione? Yes. Okay, so what you need to do is there's you have to find a couple of labs that do, it's called micronutrient testing. I used to use a lab called SpectraCell, which is very good. Genova has, I think, also in their NutriEval, they do one. There's a new lab that I'm starting to use called Vibrant, Vibrent, and they also do glutathione levels. So you want to make sure you go to not a routine lab, but a lab that does micronutrient testing. And what micronutrient testing is, we're not looking at what's in the plasma, which is the water part of the blood, but we're looking at the cellular level, specifically either your red blood cells or your white blood cells. So it can be done. Okay. Yeah, the shrink shop, I like having one big goal versus a lot. And that's true. The thing with one big goal is that you have to break it down and have an action plan. And that's really my big thing. Is that people say, oh, I could lose weight and so forth. You got to break it down. And that's so important. Okay, so here's one. My loved one is going through menopause and can't sleep. Estradiol is less than 5. Would she benefit from HRT because she is waking up at 2 a.m.? Definitely. There is no reason to have a painful menopause. So absolutely. I do a lot of work. Besides being cardiologist, I've been doing anti-aging medicine for 20 years now, 21 years, actually almost 22 years, with both men and women. And again, there's no reason to have a painful menopause. The important thing is to work with a physician that has experience with bioidentical hormones. You don't want to use the old synthetic hormones, which we've known for many years since the Women's Health Initiative in 2002, that actually there's more heart disease, cancer, strokes. But with bioidentical, the records are quite good and results can be, I've done very good. So for sure. Okay, the good question. Let's see what else I have missed. Yes, okay, I do believe in hormone replacement. And I tell this people, and I tell this in my book as well. I have a whole section. My last real chapter is on, it's called How to Not Age Ungracefully Ever After. And hormones is part of it. And being an anti-aging medical doctor, I believe in hormone replacement therapy. But I tell people that I'm biased because I am anti-aging. Do I think it's for everybody? No. I think it should be offered to everybody that wants it, but it's not just a quality of life issue. I'm going to have less hot flashes. I'm going to sleep better. There are also some real medicinal reasons to be on hormones, okay? As women go through menopause, they lose the cardio protection they've had all those years. Their HDL goes down, their LDL goes up, their blood pressure get increased. They start developing fat in the midline. Um, so a lot of things happen that are not, that are antithetical to healthy aging. And I think, and that's really important. Bone health, very important. There's no way to better strengthen your bones. And with women, for example, estrogen helps to retard bone loss. Progesterone helps to build bone. Testosterone, which I do give to women, helps to give bone its tensile strength. So it's really important to do that. Okay, let's see now. How do you get a how do you get a couch slug like me to get motivated for working out? LOL. Okay, I think okay, that's a good question. I think Joanne mentioned it. That's your goal. Okay, so you got to break it down. So what I would do, start off simple. Okay, first of all, I think taking that evening walk for 20 minutes, which is not really for exercise, it's really to help your blood sugar, but that's also a good way to get started. And I would, again, 2 days a week, do some strength training. And by the way, when I say strength training, it's not just a bunch of curls and shoulder presses. It is upper body. Okay, remember that 60% of your muscle mass is below your belt, so we can't ignore that. It's very important. And I didn't mention also, it's one of the biggest things we're seeing now in the elderly population is this thing called, you've heard of osteoporosis, osteopenia. Now we're dealing with sarcopenia, in which loss of muscle mass is so common. And again, it's antithetical to healthy aging. When you become frail, you can't do the things that you want to do or can't used to be able to do. So I would say in your case, pick your goal. If you exercise your goal, make it simple, make it doable. I don't, people say, oh, I can do it 5 days a week. No, start off with 2 days a week. Make it so doable that you can't lose. Because when people start having lofty goals at the beginning of a year, I see this all the time, and then they don't make their goals, and they get off the wagon and they say, I knew I couldn't make it, so I'll just go back to eating garbage. So make it doable, make it something you can do. I think it's just very important. How often do you like ice baths and why? Okay. Well, first of all, they're anti-inflammatory, and which is very important when you're going through this period that we're all going through. I do a couple of different things. First of all, I take cold showers every morning. Um, and and I can teach you how to do that very easily. But first, you want to put the water, or maybe spend 30 seconds. And that's how I did the first time. I thought, my God, how the hell does anybody do this? Now I do. I take my entire shower in the cold. I wash my hair in the cold. It's very healthy for your scalp, by the way. Um, I do like ice baths. I used to do them once a week. It's a lot of preparation for them, but I do like them, and I try to stay in ice baths for like 8-10 minutes. I also do what's called fire and ice. So I go to a place in Santa Monica in which I do rounds of infrared sauna, in which I do heavy duty breathing exercises with this thing called Spiral Tiger. And then for 3 minutes, okay, then I go into the cold water plunge for a minute. I do 5 rounds of that. Or let's say I have a heavy workout and I don't do the respiratory part. After the end of my workout, I'll spend 5 minutes in the cold, like totally nude. And it's cold. Talking about 40 degrees. So I go like from 145 in the infrared sauna down to like 40 degrees in the cold plunge. So we'll talk about that. I'll make another session about that because there are a lot of benefits, but it is anti-inflammatory. It is anti-aging, and it also is good for your cardiovascular system. People say, you recommend that as a heart doctor? Absolutely. I mean, you should be checked out first by your doctor. I wouldn't just blindly recommend it to someone. But if they're healthy, yeah, I would definitely suggest it. So let me see if I don't want to miss anything. These are great questions. I'm so happy for tonight. Okay, thoughts on prolong for intermittent fasting. Okay. Yes, heard it was good for cancer as well. So fasting mimicking diet, FMD, was put together by Dr. Walter Longo. He's originally from Genoa, Italy. And he actually worked on his first study was based for cancer patients. And they've come out with some recent studies that it can be very useful for breast cancer treatment. So what happens is that 5 days, you take 5 days out of a month and you do it for 3 consecutive months, and you have a very limited amount of calories. And whether you're a man or female, whether you're 200 pounds or 80, well, you wouldn't do it if you're 80 pounds, but we all have the same caloric intake. So it's like 1,200 the first day. And then on days 4 through 5, it's 750 calories, which ain't much. Okay. And you do that for 5 days, and you do it for 3 consecutive months. So you're talking 15 days out of 90. That's pretty doable. And then after that, depending what your goals are, you can do it every month, not more frequently than that, or you do, like me, you do it every 3 months. Let's say I think I just completed my 15th or 16th cycle. Now, what have I achieved through that? I have become metabolically flexible. That means my energy sources can be fat or sugar, carbohydrates. Of course, fat is a better way. So when I do my FMD, by the end of my second day, okay, I'm already in ketosis. It would normally take someone about 5 days to get to ketosis. I can do it in 2.5 days. Do I have any special quality? No. I've been so regular about it that I have taught my body to be fat adaptive, which is great. That means I can burn fat for energy, which is really helpful. And I'm much leaner. I mean, this is the leanest I've been, other than when I would diet for a contest, and that wasn't healthy. So it's a great thing. And I think it's a safe diet. Prolong is a company that makes their own packaged food. So you have a box with 5 boxes and you eat within it. You can make your own program. It's difficult to do it as far as matching the macronutrients. Number one. Number two, people tend to underestimate how much they underdo it. The last thing I want is less than 750 calories, believe me. So I'm very good with structure. I just obey it. I go by the structure, and I do it for 5 days. And I actually look forward to it because it's kind of a spiritual thing for me. If I forgot how many million people go hungry every night on this, billion people go hungry every day on this planet. I mean, I could do it for 5 days. And it's kind of like a sacrificial thing, but in a very positive way. I don't know. That's just me. But the thing about it, it's one of the few ways to really get autophagy, in which we really get rid of the dead cellular debris that we need to get rid of. The best way to do it is with prolonged fasting, okay, like 2 and 3 day fasting. Do I want to do that? No. Do I think it's necessary? No. And I think I would get pretty catabolic. It would be hard for me to work out when I would do that kind of fasting. So I don't feel the need for me to do that. But this has been studied extensively, the prolong with FMD, and you can get the same effects by doing this program. That's why it's called fasting mimicking diet. You aren't fasting. You're just greatly limiting your caloric intake. So yeah, I'm a big fan. Okay, let me see if I got all these questions. I love this. This is really nice. Thank you. Someone said, I love the ImmunoWise. Thank you. It's a great product. I'm really happy with that. I think, let me check this before we sign off. I'd like to make sure that I got everything here. Okay, save me during. Okay, can you? So, okay, valerian root. Maybe I'm having a problem. I don't have my glasses on. Okay, can you mix valerian root with chamomile tinctures? Yes, along with. Okay, well, I don't know about the Ativan. I don't use Ativan myself, and I had a very bad experience, not once but twice, with Ambien. I don't really like any hypnotics or anti-anxiety agents myself. Fortunately, even though I need more deep wave sleep, I fall asleep quite easily. But chamomile herbal tea before bed is great. And I think with adding it to valerian root is also great. I don't know about the Ativan. Like I said, I'm not a great Ativan person, but I think the combination of valerian root, which is a natural product, along with chamomile tea is great. Okay. All right. You guys have been great. This has been a fun session for me. I knew this would be fun because I really want you to start the year off right. We all say, this is going to be my year. Like 2021 sucked. 2022 is going to be great. But it's only as great as you make it. You can't just think that this is going to be a great year. We got to put in the work. We got to have the goals. We have to work on them. And it's an ongoing process. I never stop. Because my goals are magnified this year because besides my full-time practice, I'm about to launch a book which I've never done before. I have no experience in that. So it's going to be a very exciting year. But it's all about being your own medical advocate. And I hope you guys will embrace it and read it and share it with your friends. And yeah, and do me a favor, please. All of you, hopefully you are subscribers. Please, please, please subscribe to this channel. It increases my ratings, which means more people will learn about me as a functional medicine practitioner and integrative cardiologist. And if you see one of my videos when not live, just click on the like button because that also helps. And that's great. So listen, we'll see each other in 2 weeks. I have a couple ideas for my next topic, but I haven't figured it out yet exactly. So thank you so much. Okay. Happy New Year to you all. And let's make 2022 the year of the medical advocate. Thank you. Thank you so much.